Welcome to Inside Healthcare. For the very latest on COVID-19, we go right to the front lines to talk with Dr. Craig Maddox with the Urgency Room. So, I just looked again at the latest numbers from Minnesota. I mean, they just the number of cases continue to go up, and that, and not only here, but also with our neighbors in Wisconsin. So what are you seeing here at the Urgency Room at the front lines about the number of cases?
We are seeing, an uptick in, the number of cases and the demand for testing. Our test positivity rate is about 10%, which is as high as it's been since the beginning. We had a period of time where we dipped down into the 5 to 7% positive range, meaning we were testing a number of people who didn't have the condition. And now we are actually seeing that at around 10%. And that's both for the rapid test that we do, which is the test that's in highest demand. People want to know right away whether or not they have COVID. And that test results, once we swab the patient and get it over to our lab in about 20 minutes. So we're seeing consistency in the positivity rate among those tests and the send-out tests that we have access to as well. And the downside of the send-out, of course, is that it's a 3 to 5 day turnaround time. So it's not quite as easy for people to make plans based on their test results with the send-out.
Are most of those that you're seeing, are they having symptoms, no symptoms? And if they are having symptoms, what are the symptoms?
Yeah, I think the majority of people that we are testing are symptomatic. And those symptoms vary, but mostly they're cold-like symptoms. We are in the urgency room, so we aren't seeing as many of the people like I see when I work in our emergency department, where they're very short of breath or very dehydrated. And we get those patients, but just not in the same numbers that we're seeing in an emergency department. So I think people are doing a relatively good job of self-triaging, finding the right level of service, clinical service intensity for their symptoms. So mostly the patients that we're seeing in the UR are patients with fever, body aches, cold symptoms, stuffy runny nose or sore throat. A little less so in the patients with the gastrointestinal symptoms of COVID, but we are seeing that. And then the hallmark that sort of secures the diagnosis in many cases is that patient that comes in with a loss of taste or smell, because we don't see that with general viral infections or seasonal allergies. Really, that's a pretty unique feature to COVID. And I think there's a pretty high correlation between that unique symptom pattern and COVID positivity.
It seems like I've been running into a lot of people. I'm not out very often, but when I am, it seems like some people have had some coughs, scratchy throats, just cold, no fever kind of thing. Is that what you're also seeing? Or are you seeing flu cases already yet?
We have not seen any flu cases yet. And we are closely tracking the Department of Health, Minnesota Department of Health's website and the CDC website regarding in the influenza season as it's coming along. And we haven't started testing for that yet, but that testing will be emerging probably within the next several weeks to month or so. And I think one of the interesting challenges that our community is going to face is many of the health systems are not going to have access to or offer rapid influenza testing. It's because of supplies for swab and reagent and testing capacity for COVID, et cetera. So that's going to really change the dynamic for patients seeking care in their primary care clinic or in the emergency department for influenza-like symptoms. I think we feel fortunate in the URs that much like our rapid COVID testing, we still have access to rapid influenza testing that's highly specific and sensitive, that we have good confidence in. But it's going to be a challenge for our community as influenza comes around. And as our communities move into tighter spaces as it gets colder, right? This outdoor dining thing is likely to go away. And then we're into the holiday season where people want to spend time with family and friends. And, being humans and being social creatures, we want to connect with people and be around people that we care about. And it's going to be harder as a consequence of this pandemic
I know my family, we're already thinking, what are we going to do? I mean, this
Yeah.
may be the year that we don't get together as a family.
And I would say,
go ahead.
I was going to say, I would say that that's one of the things that we have seen kind of emerge over the last month to 6 weeks, is that the exposure, the side of exposure tends to be these intimate family gatherings. So weddings, birthdays, vacationing together, those kinds of things. Knock on wood, we've been really fortunate in the URs that our PPE use, our personal protective equipment utilization, has really protected our staff from getting sick. We've had very, very few healthcare worker related infections from a work environment, but we've had more from a social environment. And then obviously, the patients that we're caring for, they're coming in saying, well, my husband got it from work and we live at home. And of course, we aren't wearing masks around each other at home. So they have a high risk exposure. And, that's how we're seeing this spread of late.
Yeah, it seems like the schools too, they're saying that their exposure has been outside of the schools as well, in the community. That
Right.
So that seems to be the trend right now. Also, of the 134,000 more confirmed cases here in Minnesota, you were saying that some are mostly those small gatherings. Also seems like we're seeing an increase in the rural areas too. When I was looking at some of that stat, it looked like, up north, there's a lot more cases than I thought there would be.
Right. And I think, if you look even at the map of the United States, I mean, the way it spread, right, from the initial outbreak of the pandemic, it was in those high density urban areas in the Pacific Northwest and in California and New York. And then it took a little bit of time before the transmission sort of made its way down to the south and then kind of up through the Mississippi River Valley, right? And now it's in all of those states that sort of border Minnesota, North Dakota being one of the highest per capita infectivity rates in the world right now. And I think it's just a function of, once it gets into your community, all of the things apply to prevent it from spreading. But once it's there, it creates a risk for your community.
Well, Dr. Craig Maddox with the Urgency Room, always a pleasure to have you back on the show. So thank you for taking time out. I know, again, how busy you are. So thank you so much.
My pleasure. Stay safe.
When my sister Chris was diagnosed with breast cancer, it was hard enough, but I can't imagine if she was battling it today in the middle of a pandemic. In a moment, we will hear what kind of impact COVID-19 is having on women battling breast cancer. But first, a program that is helping newly diagnosed breast cancer patients.
Just gonna set up bed.
Next time, okay. Go ahead, your turn. I was 34. My older daughter was 3, and my youngest was just about 7 months. Okay, Marin's gonna go first. I found a lump, and they wanted to proceed with a biopsy right away, and then a couple days later I got a phone call and found out that, yep, I sure did, had breast cancer. The message to her when I was diagnosed was that Mommy is sick, I have cancer, but the doctors are gonna help me get better. I had a lot of great support from friends and family too. They really rallied, and that made all the difference in the world. I'm still incredibly grateful. I think that it helped me to take this experience that I had and do something good with it. I want to provide support to let, in general, these young moms know that it's going to be okay. This is something that you can get through, and I understand what you're worrying about and a lot of times what you're feeling through this process.
we were matched well in that way. So then we could kind of talk through like, oh, well, how do you, tell your kids when they're this age, or how do you, deal with when they ask you why you're sick. She's just like my special angel, that just kind of knows what happened, how you feel, how it is to be, like a working mom and going through a scare like that.
I get out of the Firefly Sisterhood that I didn't realize. I mean, I thought I was going to be giving back, but I'm getting so much as a survivor because I have the opportunity to process still my journey, and it's something that I didn't really know that I needed to do until it started to happen. Kind of a way for us all to heal and to take, this negative experience and do something really good with it, be a part of something really good. All right, bye, Mindy.
Why don't you tell us about how has this been since COVID-19 has really interrupted a lot of people's lives right now? How has this impacted women, especially newly diagnosed with breast cancer right now?
It's been really difficult. I think right at the first part in March, people just didn't know what to do. And a lot of clinics made the decision to close down or really change their protocols. So or push you back. So for the first part of the pandemic, women were pushed back. If you did have to have chemo or surgeries, you just really didn't have it. But if you had to go alone. So imagine going in to get your chemotherapy, your infusion room, and you're there all by yourself. You can't have a couple of friends with you. You can't have someone holding your hand. And I think that is still happening, that you're really having to go get your treatment alone. And you're having telehealth calls with your spouse or significant other, and they may be sitting in the parking lot on the call as you're in the clinic. So a lot of separation and isolation. And then obviously the isolation that comes with just not being able to be around people. And so that's really, I think, the biggest thing that we've seen is the isolation.
I just can't imagine having to go through that and then dealing on top of that with this pandemic. I mean, that's just crazy. It's just so difficult. I can't imagine. So you're with the Firefly Sisterhood. Mm-hmm. How is that working or during this period as well?
It's going well. I will say we are busier than we were this time last year. We sort of tracked our numbers, and we've had a 25% growth in requests for our services, which is no surprise because it's someone to talk to. We have always done a lot of our work, phone, email, and text, and in fact have been virtual in our officing for 2 years. So those pieces really didn't change for us. What has changed, though, is we have been doing trainings, and we like to do our trainings for our new peer mentors in person. We couldn't do that anymore, and I don't think we'll do that for another 12 to 18 months. Just because of immunocompromised women being together. That just doesn't work. So we did have to make that virtual, and actually it's been really good because it's easier for more women to attend a training virtually than leave their office at 4:30 to be there by 5:30 and then spend the evening there. And so we're finding a lot, and I know other nonprofits are having the same kind of luck of more people attending.
Maybe you can tell us, for those not familiar with the Firefly Sisterhood, how does that work, or what's involved with the training and your guides, and how they can help newly diagnosed breast cancer women?
Well, a lot of women, when they finish their breast cancer treatment, want to find a way to give back. And we are one of those ways. We do peer mentoring. So the women we call guides, they are really peer mentors. We just use the term guides because guides light the way. And so you go through an intake interview tell us your story, all the nitty gritty details, what chemo you had, what surgeries you had, all of those pieces. And also a little bit about your life and what it was like for you. Because when we match women on their age, diagnosis, treatment, and life experience. So that life experience piece is sort of the secret sauce in our matching. And then we ask you to go through a 3-hour training. We have guardrails in our program. You can't recommend medical treatments, and you also can't recommend clinics or doctors. Everybody responds to their clinics or doctors differently. So we really do set that as a standard for us. And you are mentored in asking insightful questions, listening with empathy, role playing, all those things that really make a strong mentor. And then once you're done, you go into our roster, and we have currently 130 women who are trained guides. And so it happens that if we get a request that you match partially or most of the way, we'll reach out to you and say, are you available? And we've found that our guides right now have been very generous with their time and very, very responsive, because they can't imagine going through their breast cancer at the same time we are living in a pandemic.
I can't really even imagine what that must be like. So how does someone who has been newly diagnosed with breast cancer, how do they get in touch with Firefly Sisterhood?
It's pretty easy. Hopefully they've heard from us from their clinic, their nurse navigator or their social worker. But otherwise, our website is fireflysister.org, and there's a big button that says Get Connected. That will tell us that you are looking for a match. We will respond to your requests within 24 hours, 7 days a week. We don't want to be the program you have to wait for. And then we'll set up an informational interview on your side to understand what is happening with you, what your needs are, what you're looking for, and we'll make the match, usually within a week. We're just a little busy. It used to be a shorter period, but we've got lots of requests out there right now.
Wow. And then how does it look for on the months going into the winter months? We've got the flu coming on here on top of COVID-19. I mean, what does it look like for program as well, and for these women newly diagnosed?
A couple of things. So I was just looking at some numbers the other day, and there has been a decrease by 87% in the mammograms that have been done over last year. So women are delaying getting their mammograms, which will lead to later diagnoses and later stage cancer. So I think we're going to see that coming down around. This is also always a very busy time of year, October, because of Breast Cancer Awareness Month, but also because people are using their HSA money up, so they're getting their mammograms. And even though we know the mammogram numbers are down, people are they're going up a little bit. So we usually get very busy around this time for the next 6 to 9 months, but we've been busy all the time for the last year, so there's really no downtime. What we have also been able to do is create some educational programs for women. We've had requests from caregivers to talk to other caregivers. We've had women who are 10, 12 years out coming back and saying, you know, I'm really, really scared. Is there somebody I can talk to? So that's been an interesting thing. So how do we serve those women? Our educational programs are about self-care, how to partner with your medical team. Tonight we're hosting one on financial issues to be thinking about when you have cancer. So more day-to-day issues you might be facing, but it's an opportunity also to have that information and in a Zoom setting, which actually can be very comforting.
How did they find out about it? Just online?
Just online. We have a Facebook page. What else? We told clinics. So it's a new program for us, and we're waiting to see it's been successful so far. So we're waiting to see how we can keep doing this on a regular basis.
And what would be that website or phone number that people can contact for more information about fire?
It would be fireflysister.org. And actually, they can just contact me. My number is 612-396-5336. And I'll get them in the right direction.
Final comments for our viewers. Any final comments that you might
Oh,
have?
I'm sorry. Get your mammogram. Don't wait. Early screening and early detection is so important. So don't wait.
Well, Chris, awesome to have you back on Inside Healthcare. Good to see you, and thank you for what you do with the program. I think it's wonderful, and it's so needed right now. So thank you for.
Oh, I appreciate it. Thank you.
Son, love is like the ocean. You have to tread the
Oh,
waters.
Dad, that's not the kind of help I needed. Jessica, will you go to prom with me?
Yes.
Thousands of teens in foster care can't wait to share their first with you.
Welcome back to Inside Healthcare. Joining us now is Jennifer Kamesic with a community thread to tell us about their Holiday Hope program, how it's going and how COVID-19 is impacting it, as well as how people can help. So glad to have you here, Jennifer.
Thanks for having me.
It's really a pleasure. So the program's been around. First, let's start off with Community Thread for people that aren't familiar. What is Community Thread all about?
Yeah, Community Thread is a nonprofit based in Stillwater. Our vision is a community where all people are engaged, enriched, and connected. And so we do that through leveraging resources and volunteers to help those in our community. We've been around for over 50 years. We started with giving people rides for medical appointments, and we still do that today.
And the Holiday Hope program has been around also 50 years, or?
This is our 50th year, 2020.
It is, wow.
Yes.
That's it. So what is the Holiday Hope program all about, and how does it work and everything?
Sure. So Holiday Hope connects people in need with sponsors able to help them. And so families with people or children under 18 and under, older adults and adults with disabilities are able to apply for holiday gifts and a meal. We find sponsors to then sponsor those families and individuals in the community and provide those things.
And you do hundreds of families each year?
Last year we served over 400 households.
Wow.
That included just over 1,200 people. Of that, just over 600 were children. So
that's wonderful.
And in the last 10 years, we've seen 40% increase in growth in Holiday Hope.
So how does it work? People find out about it, they sign up for it, or volunteers sign? I mean, how do you match people, and how does that all work?
Yeah, so we sign people up. A lot of it's through word of mouth since we've been around for so long. We also register. We partner with Valley Outreach in Stillwater, and this year we're partnering with Christian Cupboard in Oakdale to register people carside this year as they're picking up food.
Oh, that'll be great. And this happens throughout the month of November and December, or?
Typically, we start the beginning of November, and then we will end registration the beginning of December. This year, because of COVID, we had to start registration actually October 1st. We used to do mass registrations at Community Thread. This year, we just can't do that. So it's more one-on-one registrations, or we're doing completely online.
So how has COVID impacted you? You said you had to start earlier because of COVID. I mean, what has COVID meant for the program this year?
Well, even before the pandemic, because it being our 50th year, we had talked about expanding. So we've always served the Stillwater School District, Stillwater Area School District. This year we expanded to include Oakdale, Woodbury, and Landfall. And so we knew there was going to be growth with that already. COVID-19 has impacted families that we've never seen apply before. And so we have a lot of people who have lost jobs, are just financially impacted right now. And so they need a little help. And so that's what we're there for.
I just can't imagine, you've got holidays coming up, you've got a pandemic, you're supposed to be social isolating. I mean, it's incredible that, what havoc it has played on people's lives and that. So it's wonderful that you're still able to do the program. And why did you decide to expand it to some of the other communities then?
Just being our 50th year. We thought if any year we were going to do it, this was going to be the year. There was a holiday program went away that was in partnership with Christian Cupboard and King of Kings Church. And so where do those people turn? And so we stepped in to expand the program there, and it's been a great partnership with Christian Cupboard to get people registered.
And talking about Christian Cupboard, I was there doing another story, and they said, I think back in March they were having about 4,500 individuals a month that they were serving. And now it's like 17,000 people that they're serving. And they said, like you said, people that have never been in this position before, never been to a food shelf before. So it's just got to be so hard for our families and kids too. So
And we're seeing people from Woodbury and Oakdale and Landfall that never knew of our program, and they're just so grateful that they have this as an option this year.
So as the executive director of the program, of the Community Thread, so what do you think about that? What does this mean to you to be able to provide this to people in our communities?
Yeah, being the director of the Volunteer Center, I think it's seeing those communities and knowing that we can step in and fill that gap that they may see. And it might just be this year that they need our help, but we're also there for long term too.
And what kind of response are you getting from families that you're going to be able to help them this year?
Yeah, I think people are really grateful, not only for a gift card for food, but also to be able to buy some gifts for their children. And some people just need gas for their car. And so we're able to provide those gift cards for families and individuals.
And that's kind of how our viewers can help out. How can they help you?
Yeah, so I was going to say, as of noon today, we already had almost 1,200 people registered in a month. So we're already at where we were last year. So we need sponsors. We need individuals, organizations, businesses that want to help somebody. And so you could sponsor an individual, an older adult in our community. You could also sponsor a family of 2, a family of 7. It's really up to the individual or organization. And then we're also just collecting gift cards. In order to keep people safe this year, we aren't doing personalized gifts like we normally do, and so we're doing gift cards. So we're collecting gift cards in $25 amounts. On our website, we have a list of those kind of highest gift card requests we're seeing.
And it seems like then you're also helping the local businesses by buying the gift cards from them and then donating them. It's kind of a win-win situation for everybody. So how do people go about signing up or getting involved with it? What do they do?
Yeah, so our website, Community Thread, mn.org, there's a Holiday Hope banner that pops up right away, and you can click on that. And so there's a sponsor form completely done online where you'd be able to indicate the community that you want to sponsor someone from, the size of a family, size of a household. And then we started matching this week, and so then you will get your match. You shop for those items and then get them back to Community Thread. The gift card request is also on the website, and so if you can donate a $25 gift card, we'd be grateful. And the stores are listed on that website also.
Well, Jennifer, a pleasure to have you on the program. We love what you're doing, so thank you very much.
Thanks for having me.
And good luck with the whole success of the program this year.
you.
Well, that is our program for you. We thank you for joining us. We hope you come and join us next time on Inside Healthcare. We'll see you then, everyone.